Hello, everyone. Welcome to the Ochsner Therapy and Wellness Career Conversation. I am the Talent Acquisition Recruiter, Edra Harris. Thank you for joining us this evening. The Ochsner Therapy and Wellness team is excited to share more about the amazing career opportunities that we have with you. You will have an opportunity to ask questions in the Q&A segment during the presentation, and we will answer them at the during the T&A section at the end of the session. Dr. Rebecca Courtney will introduce our executive team.
Hi, everyone. Good evening, and thank you so much for joining us today. My name is Rebecca Courtney, and I'm the Director of System Outpatient Rehab for Ochsner Therapy and Wellness. I've been with Ochsner for 10 years, and I started my career here as a new grad PT just 3 weeks after finishing PT school graduation. My favorite thing about my career with Ochsner is that it's afforded me the ability to really pursue my passion through the investment I've received into my development as both a clinician and a leader. I'm going to give you a brief overview of who we are, some things that we've accomplished, and then turn it over to some of our leaders to share more about their specific areas of oversight today. Ochsner Therapy and Wellness is a network of 25 outpatient therapy clinics spanning 5 geographic regions and partnering with 5 major healthcare systems. We offer exceptional patient care in 18 clinical specialty areas through a team of more than 215 clinicians. We roll up through the Health and Wellness Solutions Division, which is comprised of 7 departments who work closely together to provide a well-rounded experience for our consumers, patients, and community. Our division is led by David Gaines, our CEO of Ochsner Health and Wellness Solutions and Senior Vice President of Public Affairs. Deidre Diaz is our VP of the Health and Wellness Solutions Division, and she oversees the 7 departments in our roll-up, which include the Ochsner Fitness Centers, home medical equipment, and Ochsner Performance Training, among others. Stacey Newell is our AVP who leads the Therapy and Wellness Department. Stacey is a physical therapist by background and has more than 25 years of leadership experience. 2020 was a challenging year, but despite this, our team was able to accomplish some really incredible things. I'd like to share a little bit with you today to give you an idea of what we celebrate, recognize, and value. Our patient experience scores last year were 96.2% likely to recommend for the year, which puts us in the top 13% in the nation. When COVID hit, we created a volunteer process to allow continued experiences for students in our community to obtain the necessary hours they needed to apply to PT and OT school. We also were able to pivot our normal operations to provide nearly 1,900 virtual therapy visits. Our sports residency program last year was awarded a 5-year accreditation, and the groundwork was laid to start our ortho residency program this fall. At a time when many businesses were struggling, we continued to hire clinicians to support our growth and grew our clinical team by nearly 15% during a pandemic. We focused on our physician relationships and increased our provider internal referrals to 83%. And finally, we continued to invest in our therapists through education, training 64 students, hosting 8 courses, funding 4 specialty certifications, and publishing 14 hours of content for clinical competencies. 2020 certainly challenged us, but we accomplished a great deal together as a team. With that, I'm going to turn it over to Nakia now to tell us more about pediatrics.
Thank you, Rebecca. Hello, everyone. My name is Nakia Lewis, and I've been employed with Ochsner for 8 years. I'm a licensed physical therapist, and I've spent the majority of my 24-year career in the specialty area of pediatrics. However, I have experience working in all areas of physical therapy. My role on the team is Director of System Pediatric Outpatient Rehab Services. I'm proud to say that we currently have 40 staff who support operations at 7 pediatric outpatient rehab locations, in addition to partnerships with St. Tammany and St. Charles Parish hospitals. Together, we work to systemize pediatric rehab programming across 3 geographical regions. Our pediatric sites are comprised of PTs, OTs, speech therapists, rehab techs, and front desk support individuals. Our therapists provide patients with a variety of best practice care models in the form of multidisciplinary clinic evaluations, seating and positioning needs, just to name a few. Our therapists also have the opportunity to collaborate across the continuum of care with the NICU and inpatient rehab departments, school-based services and early intervention programs. Next, I will turn it over to Amy McHugh, Rehab Manager of the Baton Rouge region, to kick off discussions about our adult rehab programs.
Thank you, Nakia, and hello, everyone. I am Amy McHugh. I am a physical therapist and the Clinical Operations Manager for the Baton Rouge and West regions. Within the Baton Rouge region, we have 5 outpatient clinics and 1 pelvic health treatment site in one of Ochsner's primary care clinics. We have 2 large clinics in Baton Rouge. One is located within the Grove Medical Complex, and one is adjacent to the O'Neill Hospital campus. The Grove is the focal point of our sports rehab program and orthopedics, in addition to aquatic therapy, hand rehab, and neuro rehab at this site. The O'Neill Clinic, our other large clinic, provides rehab services for orthopedics, pelvic health, lymphedema, healthy back, and hand rehab, just to mention a few of our specialty programs at that site. 3 of our smaller clinics in the region are located in Hammond, Gonzales, and LaPlace. Each of these sites provide general orthopedic and neuro rehab services, in addition to post-COVID and hand rehab in the Hammond Clinic and cancer rehab and hand rehab at the LaPlace Clinic. Finally, we have a dedicated pelvic health treatment area in the Bluebonnet Primary Care Clinic located within the city of Baton Rouge. We are experiencing a tremendous amount of growth in this region, and we are very excited about our future opportunities here. Now I'd like to pass it on to Shelley Ravello.
Thank you, Amy. Hi, everyone. I'm Shelley Ravello. I'm the Clinical Operations Manager for primarily the Northshore Region, also Hancock, Mississippi, and a couple South Shore clinics. I'm also a licensed physical therapist, and I've been with Ochsner just over 6 years. One thing I love about my career with Ochsner is my ability to touch so many lives in the position that I'm in and help my teams to be successful. The North Shore is really split into 3 regions: St. Tammany West, St. Tammany East, and the Hancock, Mississippi. St. Tammany West includes the Covington Clinic, the Mandeville Clinic, and our partnership with St. Tammany Parish Hospital. The Covington Clinic is our largest site in the West, and the primary offering is sports medicine, orthopedics, and the Healthy Back program. The Mandeville Clinic is the smaller site and offers general orthopedics, vestibular therapy, and a new offering of pelvic health. We also have neuro and lymphedema therapy with our partnership through St. Tammany Parish Hospital. St. Tammany East is made up of 3 clinics in Slidell: OMC North Shore, the Gauze Clinic, and our partnership with Slidell Memorial Hospital. OMC North Shore is our specialty clinic offering multidisciplinary neuro services, concussion, vestibular, lymphedema, and a new offering of pelvic health that we are actively recruiting for. The Gauze Clinic is a smaller site that sees general orthopedics, sports medicine, and hand therapy. And the current partnership with Slidell Memorial Hospital will become a co-branded OTW clinic to be opened in the 4th quarter of this year. That site will become the largest clinic in Slidell and will offer sports therapy, orthopedics, and the Healthy Back program, much like the Covington Clinic in the West. And the final part of this trio is Ochsner Hancock on the coast of Mississippi. Hancock is new to OTW as of January this year. They have 2 clinics, one located in Diamond Head and the other in Bay St. Louis. They are both community-based clinics and see general, neuro, and orthopedics. We expect these clinics to continue to grow as we continue to learn more about the needs on the coast of Mississippi. Now I'm going to pass it off to Richie to tell you more about the clinics in the greater New Orleans region.
Hi, everyone. My name is Richie Schnittelbeck. I'm a physical therapist, and I'm one of the operations managers for Ochsner Therapy Wellness and have most of the greater New Orleans region under me. I've been with Ochsner for 14 years. So some of the sites that we have in the greater New Orleans region is in our Metairie location. Our biggest site is the Veterans Clinic, which houses houses orthopedics and our neuro population. Then our Benson Cancer Center is one of our smaller sites that treats the cancer population. And then occupational health that's opening in July. That's on Homo Boulevard to treat occupational health. In the Kenner region is our Driftwood Clinic. It's one of our bigger sites in the river region. that offers orthopedics and neurological treatment. On our west bank is our big clinic on Belle Meade on Lapalco Boulevard. It is a multi-specialty site program that offers orthopedics, neurotherapy, pediatric OT and speech, pelvic health, and healthy back. In the Harahan region, we have 3 clinics. We have 2 at Elmwood. The Elmwood first floor offers orthopedics and sports medicine, and our second floor offers general orthopedics and total joint programming. Across the street in our fitness center is one of our smaller sites within the fitness center that treats general orthopedics. In our uptown region, we have 2 medium sites. One is our Chapatulas clinic that treats general orthopedics, and our Bathurst location that treats our healthy back program along with general orthopedics. In New Orleans East, we have a site at our Michoud NASA facility that treats general orthopedics. And with that, I will turn it over to Jimmy Miller, the director of St. Charles Parish.
Hi, everyone. My name is Jimmy Miller. I'm a physical therapist by trade, and I manage the therapy and wellness clinics here in St. Charles Parish. I've been here 21 years, and I've really enjoyed working for Ochsner and my growth opportunities that I've had. We have several clinics in St. Charles Parish. We have 2 clinics in Destrehan and 1 in Luling. In Destrehan, we have an adult multi-specialty clinic off of Ormond Boulevard. And this clinic is geared towards sports and orthopedics, post-surgical care, hand therapy, dry needling, and in June, we are opening a performance training center at this location. And we offer PT and OT at that location. And our other clinic in Destrehan is located on River Road in Plantation View. And that clinic is strictly pediatrics, offering multi-specialty services for peds, including PT, OT, and speech. The clinic in Luling is located at St. Charles Hospital Medical Office Building, which is attached to the hospital in St. Charles Parish. And this is an adult multi-specialty clinic geared towards post-surgical care, geriatrics, dry needling, neuro patients. We also do wound care there. And we've opened a pelvic health unit at that location as well. And those are our offerings in St. Charles Parish. And with that, I will turn it over to Ashley Dew.
Thanks, Jimmy. Hi, everyone. I'm Ashley Dew, and I am a PT by background and the Director of Clinical Excellence for the Ochsner Therapy and Wellness team. I have been at Ochsner for 8.5 years, and one of the things I love most about working for Ochsner is not only my team, but also the growth and all the opportunities in rehab that I've been able to be a part of. And also I can say it's amazing to work for such a supportive and innovative organization. In Ochsner Therapy and Wellness, we have over 18 specialty areas that align with Ochsner Centers of Excellence. And this includes areas such as orthopedics, cancer, occupational health, pelvic health, sports and spine, pediatrics, and neuro, just to name a few. In the past year, we've had the opportunity to even support COVID recovery and therapy by starting a program in this new specialty area. Our therapists are also involved with our physician teams in multidisciplinary clinics. Ochsner serves as the experts in many specialty areas, not only for Louisiana, but in the Gulf South area. And patients come from all over to be evaluated by our physician and therapy teams. The leaders that make up my team have a very unique role and job in rehab. And I have 7 clinical experts that work with me to systemize and grow specialty programming for therapy and wellness and its partners. They are in charge of physician relationships, marketing, mentoring our team, community events, and also work very closely with operations and the education team to drive programming for the organization. And next is an example of one of our marketing pieces for neuro that really is a great example of how deep many of our programs and specialties are. And down the left, you see an example of our clinic locations, but then across the top shows the specialized area within all the specialty areas within neuro. In almost all cases, our programs have this type of depth. And now I'm going to turn it over to Judith Halverson to talk about education.
Hi, Judith. Would you mind trying to unmute one more time?
I'm sorry. All right, I'll start over again. Thanks, Ashley. My name's Judith Halverson, and I am the education manager for Ochsner Therapy and Wellness. I am a physical therapist and have been with Ochsner for a little, just about 8 years. One of the things that I love about Ochsner is that it lets me meld my passions. One is to take care of our patients, and the other is that I can be an educator. And the role of the educator was created about 5 years ago, and I had the opportunity to step into that role. As education manager, I'm responsible for ensuring a smooth onboarding for our employees, securing meaningful continuing education for our staff, and developing competencies, as well as making sure that our student program works. As you saw from the pictures in the prior slide, we provide education in a lot of ways. Our rehabilitation technicians receive training throughout the year to help them get into therapy schools. We provide training to our staff by bringing in continuing ed and creating that of our own. We also participate in conferences that give our therapists the opportunity not only to participate in the conference, but to teach at these conferences. So there's a lot of opportunities. Also, we provide continuing education support financially. We extend up to $500 for registration fees. We have a wonderful program called our Clinical Specialty Fund, which provides for dollars to support those who are seeking clinical specialties such as sports certification, orthopedic certification, and other specialty areas. Another really key area I think that is a real benefit of being part of a larger organization is that we have a medical library with Ochsner that gives us access to a powerful research tool such as PubMed and other search engines. Also, as an employee, as I mentioned before, you have opportunities to share your knowledge and be among those who have the expertise and learn from them as well. After 1 year, our new employees are able to participate and have students with them. And because we provide direct access in Louisiana, after 2 years after graduation, you're able to seek credentialing to be a direct access therapist. I will now turn it over to Mark.
Thank you, Judith. My name is Mark Gutierrez, and I'm the manager of residency programs at Ochsner Therapy and Wellness. I'm board certified in orthopedics and sports, as well as fellowship trained in manual therapy, and I'm a treating clinician at Elmwood. I've been with Ochsner for a little over 2 years, and I have the honor of leading our APTA accredited sports residency program, as well as our orthopedic residency program, which is going through candidacy status currently. The fact that Ochsner Therapy and Wellness has residency programs at all demonstrates the organization supports professional development for clinicians and understands the importance of providing specialty care for our patients. Both of our programs are housed at strategic locations throughout the department and allow for substantial collaboration with our physicians as well as other members of our care team. Currently, our programs are located on the South Shore and Slidell regions, and we have plans to expand sites in the next coming year. We have a large residency faculty of board certified specialists to provide the most important part of residency, which is mentorship. For example, we have a large collection of sports certified specialists in the state at our Elmwood location. Both of our programs are full-time programs lasting 13 months in total and begin each fall. Residents are eligible for full benefits just like other frontline staff. Applications are open to both OTW employees as well as external candidates. And our next application deadline is actually Friday for our 2021 cohort. If you want more information, we'd be happy to provide that, as well as going onto our Ochsner Therapy website and clicking the residency tab. And with that, I'll pass it over to Margaret Haferman.
Hey everyone, I'm Margaret Haferman. I'm an athletic trainer by background, so a little bit different background. I've been with Ochsner about 2.5 years, but have been practicing in healthcare for almost 30. I hate to say that. And my job is the Director of Patient Experience and Innovation. So all of our front desk, all of our processes and Epic, and any of our innovation and technologies that make life better. But another piece of my team is actually our float pool. So as you've heard, we have a plethora of programs. We have a variety of clinics and locations. And as a new grad, you might not know quite what you want to do. And the float pool gives you an opportunity to kind of taste a variety of environments and see what treatment type really fits your needs. So with our floaters, we have them regionally for the South Shore, Baton Rouge, the North Shore, and you'd be able to float full-time. You're not set at a clinic, you're kind of rotating throughout the clinics. We do offer a shift differential for those float therapists. And we have full-time opportunities. So if that's something you're not quite sure what patient population you want to treat, this might be a perfect opportunity. And with that, we also have some blended opportunities with our inpatients. So I'm going to pass it to Judd Patterson and have him go through some of our other options.
Hi, everyone. My name is Judd Patterson. I'm an occupational therapist, and I've been with Ochsner for 19 years. And one of the really exciting things I think about working for Ochsner is certainly the stability that it's provided and just the opportunity to work in a variety of settings and with just an amazing group of people. So you've heard about some of the fantastic teams that we have from an outpatient standpoint. We also service from our PT standpoint with all of our hospitals, ranging from Baton Rouge, the New Orleans metro area, of course, our Jeff Highway Hospital, Kenner, West Bank, Baptist, Slidell, all the way to the North Shore and Mississippi. In our acute care settings, we have the opportunity to work in the intensive care unit. We have the opportunity to work in our neonatal intensive care unit, with our post-op patients, with our cardiac patients, cancer patients, so just a variety of acutely ill patients. If you have the desire to work with a multidisciplinary team, so interacting with physicians, nurses, respiratory, PT, OT, speech, then the acute care setting might be more of what you're looking for. We have a variety of experiences on our teams. We mentor our clinicians in this setting, and we are looking for some other therapists too that might not know what they want to do as far as acute care setting or outpatient. So we're looking at opportunities to give people the ability to float between the hospital and an outpatient care setting. And with that, I will turn it back over to Edra.
Hi, everyone. Again, my name is Edra. I am the talent acquisition recruiter for Ochsner Therapy and Wellness. I've been with Ochsner about 3 years, and I've had the pleasure of working with this team for the past 2 years. And as they've all mentioned before, we have been experiencing so much growth. So I have been staying very busy. Ochsner does offer a very competitive compensation and benefits program that includes medical, vision, and 401k. We do have a tuition assistance program through Ochsner, as well as the $500 credit to help maintain your CEUs and an opportunity to get additional funds for additional certifications that Judith mentioned previously. We also have opportunities to work on your healthcare through the Pathway to Wellness program, gym discounts and on-site gyms at various locations around the city that could be for you and members of your family, as well as cell phone discounts through Verizon and AT&T, and opportunities to get discounts on computers through Sam's Club, Costco, and Dell computers. We also offer a very competitive vacation package that starts out with 18 paid days of vacation that you're able to accrue each year, 8 holidays and 1 personal day. So with that being said, I will hand it back over to Judith.
Hello again, everybody. So you have seen a lot of opportunities, both on the inpatient side through our hospitals, as well as our outpatient clinics, a lot of wonderful opportunities. So I want to just kind of paint the picture for what our clinics look like. So our hours of operation, as you can see, our clinics, as a general rule, open at 6:30 in the morning. Many of them are open until 6:30 in the evening, Monday through Friday. We have Saturdays with the need for the clinic or the patient, and that is on an as-needed basis. Our teams, as you heard, PTs, OTs, PT assistants, speech language pathologists, ATCs, health coaches, rehab techs, and our front desk, which we call patient access representatives. Our documentation system, of course, is an electronic medical record, and we use Epic. Edra spoke to you about our holidays, which is 8 paid holidays and 1 personal holiday. And then general paid time, which is what GPT stands for, is a constantly accruing paid time off for regular time or sick leave or that type of thing. We mentioned a little bit about mentorship, and I know this is a concern for new grads. Am I going to have a mentor? We have a program that we call the First Six, which is your first 6 months of employment, where we stay in close contact with you through check-ins, providing someone that's going to help you, guide you as you get your feet on the ground with us. We feel that this is an important time for you to learn and to grow and to become part of our team. And so with that, I will pass it back to Edra.
Okay, that kind of concludes our information from our leaders. I didn't see any questions come through in the chat, but I can cover some things that some frequently asked questions from candidates. I do often get a lot of questions, what growth opportunities are there within Ochsner? And I can say firsthand that this team does a great job of promoting from within, looking at opportunities for growth and looking at what locations are a good fit for different candidates. This all works very closely together. I like to use the example of, say you graduate and you start out living in New Orleans, but then you get married and you want to buy a house in Baton Rouge. Well, all of the team works closely together to see if they can find an opportunity for you at another location so that you can remain with Ochsner and as an Ochsner employee. So they do a great job of looking at lateral moves for people. And there's also, of course, room for growth. As we experience growth within the organization, there are new roles opening up all the time, supervisors and managers, and do a great job of looking at internal candidates. Another question that I often receive that's a huge concern for new grads is student loan repayment. So Ochsner doesn't exactly give you funds to help repay those loans, but they do. With Ochsner being a nonprofit, there are programs out there available that can help you with working for a nonprofit that can help you repay those loans faster. And then there is something new that Ochsner implemented this year, which is a kind of a team that helps you walk through the process of repaying those loans. So I do think that is a great benefit because that is something that is a big concern to new grads. And Ken, if the leaders want to share with, or if anyone wants to share why Ochsner is a great place for new grads to start their PT career, you're more than welcome to share at this point before we close out.
Hi, everybody. I would just like to highlight on the screen is our leadership team. And when I started here in 2010, our leadership team consisted of 3 people. And so I think it's been amazing to experience the growth and opportunities that we've had through this organization. And I wanted to just kind of showcase all of our team. Many of them have been promoted from within. A lot of us have come to Ochsner to start our career, such as myself. And, you know, I had the ability to work as a new grad for a few years, receive strong mentoring, pursue my passion of treating patients with chronic and recurrent neck and back pain, and then move into a leadership role where I could really feel like I was having a greater impact on the way that we deliver care. So it's just been an extremely rewarding experience to see our team grow by leaps and bounds over the years. And just wanted to highlight that if leadership is something you're interested in, there's so many opportunities to develop as a leader that, you know, are their life skills as well. So I think it's been a really rewarding experience. And not only do we offer fantastic clinical mentorship through our team and all of the different opportunities with education, but we have a leadership track as well.
Okay, I just want to thank everyone for participating in today's career conversation, and we hope you were able to learn a little bit more about Ochsner Therapy and Wellness. If you have any further questions, don't hesitate to reach out to me via email or phone. My email address is edra.harris@ochsner.org. Thank you.